Hello, I'm Craig Rotzler, Senior Conference Manager with CenterWatch, and welcome to today's webinar on Collect All the Money You're Owed. Put financial audits to work for you. This webinar is brought to you by PFS Clinical. PFS Clinical's mission is to provide a collaborative administrative service for research institutions so they can focus on what matters most, positive patient outcomes through innovative research. We're expecting this session to last about 45 minutes, followed by a live question and answer session. At this time, all participants are in a listen-only mode. Please feel free to prepare questions for our presenter. We encourage you to ask questions at any time during the presentation, and the questions will be addressed at the end. To ask a question, simply type your question in the area provided and press enter, and questions will not be viewable to other attendees. It's my pleasure to introduce our speaker today. David Russell has more than 25 years experience in the healthcare industry, with more than 14 in clinical research. In his role as Director of Site Strategy for PFS Clinical, he has worked with numerous sites to conduct financial audits, helping them implement key strategies in order to collect all the funds allowed in their CTAs. David has been instrumental in the building, restructuring, and the turnaround of numerous research sites throughout the country. David, it's great to have you with us today. Go ahead when you're ready.
Thank you very much, and thanks everyone for calling in and taking a few minutes to talk about a very important topic in our industry, which is really maximizing the dollars that are owed to you and how to collect all the funds that are really owed to you as well. As an agenda, we'll talk first and foremost about who really cares, or really who should care about doing financial audits and knowing the amount of dollars that are owed to you. We'll do a little bit of an overview of financial audits, and we'll really ask the question of why should we conduct a financial audit as well, and give you some answers there. We'll give you some additional considerations or some things that normally maybe you wouldn't think of, and we'll talk about, once you do a financial audit, how do you really use the data that you discover from those audits. And what I really wanted to do is take some time and go through some case studies and some real life examples of financial audits that were done, just to give you a little bit of a flavor of what you can expect at your site, or what some possibilities are. Whereas every site is different, it's good to sort of see what others have found when doing these types of audits. And then we'll talk about using best practices to really develop a process of doing financial audits. Talk about when do you do a financial audit. Then we'll summarize things, and as Craig said, we'll leave a little bit of time at the end for some questions and answers if you guys have any. So really, who cares, or again, who should care? And it's a lot of times it's targeted toward leadership or managers that are responsible for the success of the program. It really, the true answer obviously is everyone that's associated with the program, but leaders and managers obviously that are charged with making sure that funds are coming in and to make sure that you're meeting all your financial goals. Doing financial audits is really key in making sure that's happening. Those that are in larger institutions where there's research billing that takes place, those that are conducting the actual research billing reviews, adjudicating those claims, really are interested in what these results are, to see if there are things that they themselves can be billing for that they haven't been, etc. And then obviously compliance professionals to make sure that we're upholding all of the internal policies, procedures, as well as external regulations that go along with clinical trial billing. So as an overview, it's really key when you're talking about the sustainability of your organization in the industry, but specifically in clinical research, as margins sometimes can be lower, that you're collecting every dollar that's owed to you from the research site. for the research site from the sponsor of CRO. You have to look at it from a perspective of you spend a lot of time negotiating that budget, looking over what your needs are, making sure that it's in the CTA, a lot of going back and forth, and then you need to use that same fervor when making sure on the back end that you're getting paid for everything. Oftentimes there's amounts that are in the budget that you simply forget about, or that you overlook, or that you don't invoice properly, those types of things. We'll talk about those. The key in all this, and it sounds a little intuitive, but sometimes people don't think about it, is that sponsors and CROs are typically not going to remind you to send them invoices or to request the funds that you've already agreed to. They're not going to send you an email and say, oh, by the way, you haven't billed for startup funds, or that annual maintenance fee that you put in your CTA, I haven't seen an invoice in that, and it's been 14 months, those types of things. And really, those institutions who have a policy that includes doing regular and routine financial audits, you will truly find that you'll reap very large rewards in making sure that everything is collected. We'll talk a little bit about some common misperceptions that we see in research sites. And the first one is that sponsors and CROs will pay on time or pay according to the terms within the CTA. And that really is false. About 72% of payments are paid on time per the contract payment terms. So really, you look at that and you say, well, that's a high number, but really, when you think about it, that means 28%, or roughly, a little less than 3 out of 10 are not paid on time. And that can be for a host of reasons, but one is that there's some ambiguous language maybe in the CTA of when the timelines are. But the main thing is that really, typically those timelines are set up for invoiceable items. And then the thing to really remember is that the real payment trigger for the visit activity is when the data is monitored. So oftentimes what I try to do on the front end is to get a monitoring plan from the sponsor or the CRO. They typically always have one, but a lot of times they're not sharing that to you as a site on the front end. So it really becomes kind of a mystery on, you can say you can, pay 45 days after the data is monitored, but if they're only coming out, say, once a quarter or once every 8 weeks, and you're looking for monthly payments, your timelines really are not going to be met, and that could really affect your cash flow, and specifically for smaller sites. So always keep that in mind. Try to find a monitoring plan, or at least put something in there about data will be monitored ever so often, those types of things, in order for you to know when you're due your money, and then keep up with those as well. Another common misperception is that sponsors and CROs pay accurately. So that's false as well. About 70% of payments are actually paid correctly. And again, it's a high number, but that means 3 out of every 10 invoices that you send in or visit checks that you receive are inaccurate. And that also has to do with very ambiguous or confusing contract terms or language, or the staff at the sponsor of the CRO have really been poorly trained or not trained sufficiently. So we'll stop here and just say, this is not saying that sponsors or CROs intentionally are paying inaccurately. Oftentimes, I think they're doing the best that they can. But what I like to say is look at it from their perspective. As a sponsor, as a CRO, if there's a study that's going on, and we'll just generalize and say it's at 40 sites, what that typically means is that there's 40 different CTAs, 40 different budgets, 40 different payment terms. And yes, where they should have a system in place to be organized to know exactly what your specific site should be paid and when it should be paid. A lot of times, if you take that into consideration, and that's one out of however many studies that they have going on at the same time, there is room for human error in there. And as humans, we all know we do make errors. So we'll talk about it a little bit later, but it's always important when you get a payment, match that against the CTA, the budget, to make sure that you're getting paid the correct amount, because oftentimes we see where it's not paid correctly. So a third misconception is when you submit invoices that they're paid on time and accurately. And again, oftentimes it's false. About 1 in 3 invoices have to be resubmitted to the sponsor or the CRO. We've all had those emails where you hear, oh, I didn't get the invoice, or there's not enough supporting documentation to go along with this invoice. Always put as much documentation with it on the front end. Don't make them ask, because that always delays things by the time they get to processing it and then asking you for the documentation. Then you have to resubmit it, and it goes through the process all over again. And also the timing of it. Oftentimes they'll say, well, you submitted it too early, or you submitted it too late. Those types of things. So always remember, try to send the invoice within the time frames that are set out. And again, the sponsor, the CRO staff, inadequately trained as far as when those should happen. Oftentimes I've seen where maybe you're one of the few sites of the study that asks for certain invoiceable items, such as a monitoring visit to get paid for, those types of things. And so I've seen a lot of times where sites have sent invoices, they'll get a reply and say, we don't pay for that. And then you have to say, nope, look at this CTA that was signed and executed. It's in there. And then oftentimes they'll say, okay. But again, that takes time, and so always remember that as well. Some additional considerations that we like to share with individual sites is it's important to define who is responsible. So what I really mean by that is who's responsible for understanding those payment terms in each and every study, who's responsible for sending in the invoices. You certainly don't want to do double work and have multiple people sending invoices. Conversely, you don't want to have somebody think, well, that's somebody else's responsibility. It's not my responsibility. I'm not going to do it. We see both, and so in saying that, it's always nice to be clear, concise on who is actually responsible for making sure that the funds are coming in. As you're going through different financial audits or through the process, always look to identify areas that you need to train individuals on. So if there's, if you're consistently seeing invoices returned for lack of documentation, or you're consistently seeing invoices sent in late, those types of things, always try to train that individual, let them know exactly, what they should be doing. Identify the lack of a process for collection calls. Oftentimes we see many sites send in invoices and think, okay, the payment will come. And it's key, just like with any other type of facility that is due money and invoices for services. When you send out an invoice, money doesn't magically appear every single time, and sometimes follow-up is needed, and oftentimes follow-up is needed. So who's making those calls, who's watching the invoices go out and making sure the dollars are coming in is very, very key. Also, for those sites that are listening that have a CTMS system, recognize the lack of CTMS flexibility in your certain system. We see a lot of sites try to use their CTMS system as a billing system, as a financial system, and most are not really built for that. So there needs to be some sort of an external, outside of your CTMS system, way of actually tracking your revenue. CTMS systems are great for making sure that visits are scheduled and that your activity is tracked. But as far as running a true invoicing and receivable type of a system, there are limitations to what the capabilities of a CTMS system can do for you. So how do we really use the data when we're doing a financial audit? The most important thing, obviously, is to improve cash flow. And this is important to different sites in different ways. So, in other words, dedicated research centers oftentimes are, working under pretty razor-thin margins. You want collections to happen as soon as possible, just for the sustainability of your organization as a whole moving forward. Cash is obviously king, and in order to meet payroll constraints, expense constraints, those types of things, you're really going to want to maximize the dollars coming in the door, just as the lifeblood of your organization. When you get into more of the clinics and integrated health systems, whereas the overall cash flow of the department may not be an issue in those situations, what is important there is that you have the fiduciary responsibility of making sure that your department is contributing as much as possible to the bottom line of the organization as a whole, and that you are responsible in getting the dollars in the door. Oftentimes in these type settings, we see where maybe the department is running at marginal profitability, or in a lot of instances, no profitability and actually a loss. If you could mitigate that as much as possible by showing that at least you're collecting all your cash, it's not a problem, it really goes a long way in promoting your mission of doing clinical research within your organization. It also helps you gain insights in business decisions. So you're looking at different clinical areas or different specialty areas. Who's doing the best? Where do we want to focus on? Those types of things. And it helps you look at trends and see where the industry is going. And then it also helps you to recognize patterns. Again, as you're doing these audits, you're starting to see where does additional training need to be held internally. What do we need to do in order to make this a smoother, better process? Always document these type of situations, because as we put in here, prepare for turnover, because it's going to happen in our industry and in any industry where you have billing, collections, those types of situations. But we all know turnover can be a problem. But if you've got written down policies, trends, procedures, it helps that next person to come in a whole lot when they understand what it is that's gone on in the past and what they need to be doing moving forward. We've got 3 case studies that I'd like to share with you, because I think it's very important. A lot of people hear financial audits and they think, well, is it really worth taking the time to go through? Because it can be a laborious process. It can be a bit boring, but I really feel strongly that it reaps very large benefits. And so we'll go through 3 case studies, and they're all a little bit different. They all have some similarities, but because every site is a little bit different depending on your staff, depending on what your process is, depending on the size of your organization. And so we just wanted to call out sort of some of our observations. So in the first case study, there's a site that does use a CTMS system, and they're on an accrual basis. And we'll quickly cover when we talk about accrual basis versus cash basis for those that don't understand the difference. Accrual basis is you're tracking your revenue and your time and effort, and you're recording that prior to the money coming in the door. So you're actually booking revenue before cash comes in. On the third case study, we'll talk about a site that's on a cash basis, and that is you're not booking that revenue, or you're not recognizing that revenue until the actual dollars are in the door. So this site was on an accrual basis. They have 600 open studies, and I know for some sites that are listening, that's a lot of studies. For some other sites, that's about middle of the road. We took, out of that 600, we audited 12 studies, and there was a total of 56 subjects that were enrolled in those 12 studies. And what we found is that a little over $75,000 was not even invoiced, and that there was $31,000 that was invoiced, but it wasn't collected. So there was a total of $106,000 that was owed to the site from just those 12 studies. So you're averaging about $8,852 per study that is owed. Some of our findings were that 50% of the startup payments that needed to be invoiced were not even invoiced. Now, in saying that, you say, how can that be? This particular site didn't really have anyone that was attributed to sending those invoices in. So therefore, it was a case of, well, I thought someone else was doing it, or what have you. So, that means 6 of the 12 studies were not even invoiced for study startup. Of the 50% that was invoiced, there were some that weren't collected yet. So again, there was follow-up that needed to happen. There were things that, phone calls that needed to be made, those types of things. A big problem in a lot of sites is that your screen fail ratio was not calculated properly. So there were invoices that could have been sent to the sponsor that weren't, that were within the ratio parameters, but they weren't sent in. And again, a lot of sites, you've got someone who's negotiating the study budget. Always keep in mind what items in that budget are invoiceable and which ones are part of the payments that come from the monitoring visits. There is a trend in some studies where they try to get you to invoice as much as possible, and in doing that, it sets up, you have to have a good process in place to make sure those invoices are going out. So what we found in this particular case, much of the patient activity that was assumed to be automatic triggers were actually invoiceable items. And so those invoices were not going out. So you see the graph here, and you see, how much of it was administrative costs, how much of it was screen fails, and about 22% was actual patient activity that could be billed. So it's a little bit of a wrap-up of the first case study. Again, there's an average of $8,852 per study. For these particular studies, it took roughly about 2.5 hours per study. So you're looking at about $3,500 per hour. So those that are out there that, it's common misperception that, wow, it takes a long time and maybe you're not going to find much. And is it really worth it? I think we all agree that if we all worked for $3,500 per hour, it would be very fruitful for us. The second case study was a site, again, that uses a CTMS system that was on an accrual basis. They have about 250 open studies, so a bit smaller. And we only chose 5 studies. for this particular case or this particular site. And there was a total of 41 subjects enrolled. And for this one, a little over $102,000 was not invoiced, and nearly $34,000 was invoiced but not collected. So in this, there was $135,000, almost $136,000 that was owed just in 5 studies. And on this one, rather than the $8,852, this averaged actually $27,174 per study. So again, they're not doing as many studies, but the types of studies they were doing, they were enrolling more subjects, and they had higher budgets for those. So it all depends on the types of studies you're doing, et cetera. So some of the findings in this one that were a little different. So we found a better system in place for invoicing because there were initial items that were invoiced, but there was no follow-up on those. Things like annual charges, pharmacy, annual pharmacy fees, those types of things. Whereas they were invoicing being kept up with, there was not really anybody tracking those to make sure that the dollars were coming in after the invoices were sent. A lot of screen fails were not invoiced, and a lot of the patient activity was broken out into invoiceables. So in other words, if this happens, then you perform a certain test and you can invoice those tests. And that really comes down to communication, knowing, the coordinator knowing to let the invoicer know, okay, I did this particular test, you need to invoice it, those types of things. Just that communication was lacking. And then also in this one, we found that a lot of the sponsor of the CRO payments, they were rarely accurate. As we do see in a lot of cases, they were not paid exactly to the budget terms that were agreed upon. So for this one, there was a little over $27,000 as an average that was owed per study, and these were larger studies, bigger budgets. So this one actually took about 4.5 hours per study, but again, it was actually a higher yield, which was about $6,000 per hour. So again, reaps very big benefits. So yet another site that was even smaller than the first and the second was a site that was on the cash basis. They didn't have a CTMS system. They had about 140 open studies, and we chose 33 of those. So again, not as many subjects enrolled per study. We're only looking about 3 or 4 subjects per study that were enrolled. But in that, there was over $81,000 that we found in those 33 studies that were not invoiced. And then there was $110,000 that were invoiced but not collected. So, nearly $200,000 was actually owed to the site. This was a smaller site, and so you can imagine some of the smaller sites that are out there, to say you've got $200,000, and this isn't like $200,000, in most cases, like the 81 of that, you didn't even realize that you were owed that much money. So it's just, additional dollars to go onto your books and to collect and to go into the coffers that you didn't even know about. And that averaged about $5,800 per study. So about 85% of the missed revenue was actually due to lack of invoicing and the lack of collection efforts. So it was, and we all, that are in the industry, we know that we have, we're always looking for additional help and additional folks to do the administrative work, but it's just shows the importance of actually doing the due diligence, making sure that you've got the process to make sure that everything's being invoiced, those types of things. Because in this one, there really wasn't any dedicated staff that was assigned to actually do the research billing. And so you can see where, oftentimes the smaller the site, the less amount of dedicated staff, but what we find is percentage-wise, it's a larger percentage of dollars that you're not collecting. It goes hand in hand. So whether it's, whoever it may be, it's always important to assign that role to somebody internally. So again, about $5,800 per study. These were much easier studies to look at. It's about 2 hours of study. But again, let's talk about $2,900 per hour is what the yield was when we're doing these financial audits. So let's talk a little bit about processes and sort of some best practices that we see and just some tips, suggestions. I always like to see a research-only lockbox to get a lock. So that's just going to your bank, opening up a lockbox. Those checks go directly into that lockbox, and then you get a daily fax or an email showing you what came in that day. It's automatically put into your account. That's good for a number of reasons. One is you typically can get your money a couple of days earlier for those smaller sites. For the larger sites, it really minimalizes the commingling of funds. In large integrated health systems, for instance, as we're doing collections, we oftentimes, find out, the check was sent. It was sent 3 months ago, 2 months ago. You start doing some digging, and that came into, the main hospital address or the main clinic address, and that went into the pharmacy account, or it went into somebody else's account. So you have to work with accounting and get that transferred over. So again, it's important to know where, and if the lockbox is not an option, then at least maybe a different address or something attention of, so you're getting that. And then it also is a very efficient way to disseminate the payment detail. So you've got to know where that payment detail is coming from to know how to post the payments. And as we talked about throughout so far, just to have a disciplined process for reconciling receivables, have somebody that's dedicated to it, have somebody that is, on top of it, so to speak, is looking at it on a daily, weekly, monthly basis, understands the receivables, understands where some issues might or might not be, and communicating that upward. And doing periodical receivables management performance audits, just looking at, what do we have a lot of dollars that are outstanding? If so, why? Is it a lack of collections? Is it because we're using a certain sponsor or CRO heavily, and maybe that they're having some delays in payment? Just understanding your receivables and knowing and keeping on top of exactly what's going on within those receivables. So really, what we suggest is to develop a process. And the details of that process, we really say you need to create a reconciliation report for each and every study. And what that really is just a document, typically in Excel, that shows everything that should be invoiced, when it was invoiced, and keeping track of when it's coming in. That goes for invoiceable items, but it also goes for visit activity as well. It sort of goes without saying, but always request payment detail from the sponsors and the CRO if they don't provide it. And I do realize that, those that are listening that are involved in this process on a routine basis, it is so frustrating when you don't get that payment detail, that you simply get a check for, X amount of dollars, and you have no idea what it is that it's paying for or how to apply it. What we recommend is that you always request that detail, because what we do see in sites that we highly don't recommend is that money is just applied to the study itself, or maybe even just to the AR. So it goes into the third bullet point of, when you do get the payment, you have to have that detail, because you apply that payment to the individual visits or pass-through invoices that are on the patient log. So be specific. If you get into a habit of just applying that money to a certain study, you start losing that detail on exactly what is owed, because what it takes is to you look at that reconciliation report, you review it for any unpaid visits or pass-through items, and then you can talk to the sponsor or CRO about those specific items that were not paid or that haven't been paid yet. For instance, a good example is we see a lot of times a patient will get paid for visit 1, 2, 3, and 4, and then you get a payment for visit 6 and 7. You have to go back to the sponsor and say, okay, what about visit 5? What happened there? And sometimes maybe there's something wrong with the data, or there's a query, but oftentimes maybe it just got overlooked. So in order to have that detail, you're going to have to be able to post the payment to exactly what it is that they're paying for, to be accurate. And then always create a discrepancy report that you can share with your sponsor and CRO. Get a good contact for who's going to be making the payments, or who's responsible in the payment section for that sponsor or the CRO. And maybe, after each payment, say, okay, I received this payment. Here's some discrepancies I found. This visit maybe was paid different than what the budget said, etc. So again, it's, as they always say, the devil is in the details. You always have to, as hard as it may sound, you have to keep up with it on a very detailed basis going forward. So some best practices is always review collections and create a follow-up plan. And whether that's, if you're a leader listening, whether that's sitting down with the person responsible, on a every 2-week basis or on a monthly basis, just to look over exactly, so you familiarize yourself with what's going on. Do you as a leader need to be involved? Do we need to get the PI involved? I've seen that happen quite a bit. If things get extreme, those types of things. Always plan ahead. And in order to plan ahead, you have to know exactly, again, what is the monitoring plan? What are the payment terms? So as you're looking at your business moving forward, always look at what's going on. And then I always like to track those difficult sponsors or CROs, those that seem to always have an excuse of why they can't pay on time. They typically are looking for loopholes. Maybe there's some individuals that just seem to be not trained as well, those types of things. And then they use that information for the future. So if that same sponsor or CRO comes back to your site and says, okay, we want to do a sister study, or we want to do a follow-up study, or here's a different study, you can just, be very transparent with them and say, okay, yes, we can do this, but we've had some issues with you guys in the past with payments. Here's some examples. We want to put some things in the CTA that will be a little bit more specific this time, because we have had some issues. And it really allows you as a research team to just develop a list of priorities on every single study. So you know what to expect, you know how to plan, those types of things. So when should we be doing financial audits? For me, I like to do at least biannually or 2 times a year for every study. Sometimes, depending on the number of studies and the amount of staff you had, maybe that's too high of an expectation. Maybe it's an annual type of a thing, but at least having some sort of a pattern of for ongoing studies, you're looking at it on a routine basis. And what that really means is, you're going back to the original CTA or your source document. You're looking for those items that are invoiceable. Are there things such as monitoring visits, annual maintenance fees, safety reports, those types of things that you've got in the budget that you can be paid for? Because let's face it, as a site, and I've been there as well, we're dealing with a lot of studies over a long time, and it can be confusing. It can be confusing in, this study we get paid safety reports for, but this other study we don't, and that's only 2 out of 30 studies that we have ongoing. So it's always good just to go back, look at an individual study, make sure that you've been invoicing for everything. And then obviously, I always do one as soon as I sort of catch wind or hear that study enrollment is about to close or is closing. Because oftentimes, as we all know, once that happens, the sponsor is really looking to close everything out, do a data lock, etc. So in doing that, it's always important to do it just as soon as possible. Therefore, the sponsor is not closing everything out and starts the timer on when you're not going to be able to be paid. Anytime that your particular organization acquires another organization, I always go in and do a 100% audit of those just to make sure, even if the staff, seem very, very organized, those types of things, just to make sure that they're keeping up with the standards that you would expect at your own hospital. As part of a centralization effort, I know when I deal with hospitals, healthcare systems that have multiple sites or multiple hospitals that they do research in, I'm a big advocate for centralization. I've helped a lot of organizations centralize their operations. So I always like that central administrative office to be able to go out, look at if the billing and invoicing is being done in sort of a siloed effect, to go out and be part of that centralization effort, just to make sure, again, that the organization as a whole is being looked after as far as when the monies are coming in. And then when you're implementing a CTMS system, so you can realize what your rate of your ROI is moving forward. So kind of in summary, I listed some do's and don'ts, just that we can go over real quick. So as far as your do's, do conduct routine financial audits and put it on a calendar. Make sure that you're doing it on an ongoing basis. Always understand what the payment terms are for your studies, whether it's on monitoring the actual data, if that's what triggers the payment, or whether it's on invoiceable items, to know what those terms are. On every single study, you have to have a very detailed reconciliation log so you can tie out every payment that comes in. I just think that I can't overstate enough how key that is to be that detailed in your efforts. Work with your sponsor or the CRO to get a strategic schedule of when the visits will be monitored. Understand what those are, and ideally understand what those are on the front end. In other words, when you're negotiating that CTA or that budget, it's going to help you immensely in the future to know when you should be receiving payments, et cetera. So you as a leader, for instance, or as an invoicer, when that monitoring visit occurs, you can look and see exactly what data was monitored, and you can literally just start a clock and say, okay, within 30 days, I should see a check for this much money. And if that doesn't occur, you start following up, or at least you know to expect it. And so when it comes in, you're starting to look at the accuracy of that data, et cetera. Always make sure you're keeping up with all the invoiceable items. There's just so many times and so many people that I've worked with. It's just almost crazy to think about the monies and the dollars that are just not invoiced when they could be invoiced. And again, I can't reiterate enough. The sponsor is not going to remind you, and so. Whether it's keep a little cheat sheet on a folder for that study that you're sort of looking at on an ongoing basis, whatever it may be, understand what is invoiceable, when you should be sending those invoices out, and what the payment terms are on those. As far as the don'ts, don't assume that your CTMS system will accurately track your receivables. It's not really built as a financial platform. And as long as you understand that, that's fine. It's a great tool for going back and getting information out of, but as far as tracking your receivables, typically a CTMS system will not be your answer for that. And don't trust that your receivables management process to a study coordinator. We didn't talk about that a lot, but there really needs to be an administrative person that is handling the receivables. Now, whereas needs to be constant communication between the coordinator and the invoicer, as I like to say, really good research coordinators are great at coordinating studies, and that's what you want them to do. You want them to be going out looking for new patients to enroll in studies, entering the data so you can get paid timely, so you can get paid accurately. And so in doing that, the administrative load really needs to come off the coordinator as far as invoicing. Typically, they're thinking about the protocol. Typically, they're not financial people. So again, taking that load off of the coordinator. Don't ever assume that the sponsor CRO will pay you correctly. Don't simply take the check at face value without verifying it. You can trust them, but as I like to say, always trust but verify. Don't presume that if you send an invoice that you'll be paid. Again, a lot of folks will send out an invoice and forget about it and assume it's just within the payments that are coming moving forward. Always keep track of those. And then don't wait too long after the closeout visit to complete your final reconciliation. A lot of times sponsors, closeout visit will happen, and a lot of times that means you as a site are on the clock as far as getting all of your invoices in for payment. I've seen a lot of sites lose a lot of money because 6 months after the the closeout visit, they realize, there's $30,000 worth of unpaid invoices that they didn't get to us. They send an email with the invoices attached, and the response as well. In the CTA, it says, you've got 90 days after the closeout visit. By that time, it's too late, and they're not obligated to pay you at that point. So perfect time really is when you first start hearing about study startup, making sure that you've got all the payments reconciled and that you're making those requests for payments promptly before that happens. So I see we've got a little time left. Appreciate everybody's listening in today. And here's my contact information. We'll get to as many questions as we can. If there's questions that we don't get to, or if there's things that pop up in the future, never hesitate to reach out to me via email or by phone, and we can certainly talk through whatever we need to talk through.
Thank you. Ladies and gentlemen, now is your opportunity to have your questions answered by our presenter. Please remember this portion of the conference is also being recorded. And to ask a question, use the question and answer panel on the screen. Type your question there provided and press enter. We'll get to as many questions as we can in the time remaining. David, we got several questions coming in here for you. First one, they're saying back in May of last year, we billed and received payment for investigative brochure and data safety monitoring board recommendations. They have now contacted us and stated that these should not have been paid as they are not stated in the contract and they are not an IRB renewal or amendment. Do you have any suggestions for them?
So the question, as I understand it, there was items that were invoiced that maybe weren't not included in the budget and paid, and now they're coming back and saying we shouldn't have paid those. What I would do in that situation is look for any type of communication from the sponsor or the CRO that were, asking you to send those items to the IRB, et cetera, because there are items that you can bill for that aren't in the budget and contract if you've got documentation that those, certain activities should happen. But if I will say if it's not in the budget, you're probably going to have a little bit of an issue unless you've got some documentation saying that you will, that it needs to, you need to get that approval, and by the way, we'll reimburse you for it as well. So in saying that, I would certainly look for the documentation in doing that. If you don't, you might have a little bit of trouble from them withholding that from maybe future payments.
All right, thank you. The next question, they're asking for studies that pay based on data entered into the sponsor's EDC system. We find that visits are labeled differently in the EDC and the executed contract, leading to discrepancies when matching payments to logged activity in the CTMS. Do you have any strategies to assist with this?
Well, Melissa, this is a great question, and we see it all the time. And I know I could probably name 2 or 3 studies, and one of them, the name is probably one of them that you're talking about. We do see this a lot. And a couple strategies that I like to do just on a routine basis for a couple different reasons. One is I try to get the CRF forms that are going to be required for the data collection of these studies ahead of time when I'm doing the actual budget and contract negotiations. And I know sometimes they don't like to release those, but I like to get those just so I can see and talk to the coordinators about how much time is this going to take when you're calculating your budget, so you know how much to budget for, but then also for this very reason, because there are many times where I hesitate to use the word, but we'll use it, sneak some things in there where it doesn't always match up. So I think the strategy is to look at it from the front end first and start asking questions on the front end when you're doing the budget negotiations. The other strategy is to go back to the sponsor now with this sort of discrepancy and say, we need to renegotiate the budget based upon what I'm seeing here because they're not really lining up perfectly. So it's very common, specifically in data collection type studies that you're talking about, Melissa. Thank you.
Thank you. Our next question is, sponsors often send payment without adequate details to match to invoices. Do you have any strategies to ensure sponsors consistently send the full payment details?
This is really an industry problem, as we talked about in the presentation. It continues to shock me. How many times I've seen a check come through for, say, $35,000, no backup detail. Oftentimes, you're scratching your head, what study is this for? Maybe obviously you know who the sponsor of the CRO is because that's where the money's coming from. I always put in my CTAs when negotiating those that proper detail will be sent with every check. Well, we all know, even if you put that, it doesn't always happen. So my strategy is always, when I get that first payment and I realize, okay, this is going to be a consistent problem, because typically, if they don't send backup detail on the first one, they're not going to on subsequent ones. So I always try to find the best contact that I can get. And I'm going to be honest, sometimes I, implore with the study monitor, and sort of, bug him or her and just say, look, I've got to know where this detail is coming from. Who within your organization can I get? Because it's oftentimes hard to find. I have a lot of success with just dealing with the study monitors, because, they're interested in helping you out in a lot of times, and they have a lot of contacts within the organization. So yeah, first and foremost, make sure that the language is in CTA, so at least you can go back and say, okay, you're going against what you agreed upon. And then second, just try to find a really good contact.
Great, thanks. We have a question from William. What do you do when a CRO or sponsor won't pay?
So that's also a great question, William. Some of my strategies in doing that, because we do run across those, is I have sort of a heart-to-heart conversation with the PI, is what I do in those situations. I'll sit with the PI and just say, here's the study. He or she obviously knows because they're the PI in the study. They're simply not paying us. And so at that point, and obviously you're alerting everyone within your organization. Everybody knows, because what I find is that will oftentimes really make the PI upset. And if you've got a responsive PI, he'll get on the phone with his lead person, whomever. And I've had studies where I simply alert the sponsors that we are going to halt enrollment. I certainly wouldn't suggest that you've got to take care of the patients that are already on study, obviously, from an ethical perspective. But I have had studies where, an email from the PI that says we're going to stop enrollment because of lack of payment moving forward.
Thank you. Next question is from Brianna. What is the one thing that sites don't include in their budget but should? Some of the most commonly missed items.
Yeah. So I don't know that there's just one, but some of the ones that we really had success in is getting paid for monitoring visits, which didn't always happen in the past. Getting paid for safety reports, again, which didn't always happen in the past. Those annual maintenance fees that go above and beyond the initial study startup fee, because we all know the initial startup fee is to pay for all the administrative costs of getting started up. But that annual maintenance fee is to pay for things like what we're talking about, these financial audits, but then also to do the continuing reviews for the IRB, those types of things. So, we've seen, $1,000, $1,500 as an annual maintenance fee, for instance, that some sites are just not asking for.
All right, thanks. And next question is from Lori Jane. Is there a strategy to obtain payment after CTA timeframe for invoiceable items?
What we try to do is we try to be reasonable. So you don't want to stretch it out to say, whenever you get around to it, but then we also don't want to be, say it's within 15 days or 30 days. So what we try to put in the CTA is I like to see the 45 days. So that's pretty reasonable to me. So from the time that you send in the invoice, or from the time after the monitoring visit, to put in there that's a 45-day payment term. And again, if you see it if you see a sponsor or CRO consistently going past that, to bring that to their attention so they know it moving forward.
Thank you. I have one more question here from Candace. I'm sorry if we couldn't get to your question today. Are you aware of any software that could be used to manage the finances of a study, other than Excel?
Other than Excel, I mean, a lot of sites, and I personally work with a lot of sites that use QuickBooks. QuickBooks can be a little bit pricey, and you've got to do some maneuvering around it. I mean, Excel is the easiest as far as just, it's right there in front of you. But as far as an automated system where you have some reporting capabilities, those types of things, I personally like to use QuickBooks for various reasons, and because it's pretty flexible and you can set it up sort of however you want to.
Great, thank you. Looks like that's all the questions we can get to today. David, any additional remarks before we wrap things up?
Yeah, thanks, Craig. So, again, thanks everybody for listening. Please don't hesitate to reach out put the contact information there on the screen. Be glad to get with you afterwards if needed be. So, any further questions that I can answer, I can do that sort of offline. Thanks again.
Thank you very much. On behalf of FDA News and PFS Clinical, I'd like to thank our participants for joining us today. Be sure to fill out the survey at the conclusion of this webinar. Your feedback is very important to us. This now concludes today's webinar. Have a great day and hope you join us again in the future.